Thank you very much. What I'd like to do is to tell you a little bit about the Envirovet Summer Institute, which is a program initially conceived by Val Beasley. Oops, let's see, gotta get the pointer back. Val Beasley here from the University of Illinois, and in more recent years supported by my colleagues, particularly shown here on this slide and in the abstract, but unfortunately not listed in the program, from the University of California. And I'd like to tell you about this as potentially a model to think about how One Health might better be taught as an approach, a way of viewing global health problems, and for these interdisciplinary interactions that we've been hearing about in the last several days. So first off, One Health, what is that? Well, One Health is a concept that has emerged, particularly over the last 5 years, from the One Medicine concept, which was the idea over the last century that human physicians and public health physicians should get together with veterinarians and population health people focusing on animals because we could learn a lot from each other. And basically what's happened with this evolution is to even broaden the concept more, a more holistic approach to say that human health should not be viewed in isolation, but rather when we think about human global health, we should be taking into consideration the animals, not only from companionship and food animal safety, but also the ecosystem that they share, the impact that humans and their animals have on the ecosystem, and the impact that ecosystem, our air, our water, our land, has on our health. That's the concept of One Health. So the Envirovet Summer Institute, as I said, is run by the University of Illinois and the University of California, Davis, but with very strong partnership, which is what makes it so affordable, from the White Oak Conservation Center and Harbor Branch from the Florida Atlantic University. And in the last 3 years, since 3 weeks of the program have been held in Tanzania, there's been strong support from our colleagues at Sokoine University of Agriculture, from the Tanzania National Parks, and the Wildlife Conservation Society. So basically the goal of the Envirovet Summer Institute is to train leaders in global health, specifically to educate, engage, and inspire, at the present time, primarily veterinarians and biologists to become active and effective leaders on transdisciplinary teams that really take this One Health approach of looking at animal, human, and ecosystem health. And since the program was initiated in 1991, there have been over 400 trainees who've gone through the Envirovet program from 44 different countries in Africa, Asia, Europe, the Americas, and many other countries. And many of these graduates of the Envirovet Summer Institute are now in key leadership positions in their own countries. So basically what's involved in the Summer Institute, it's a 7-week program. Every year, 25 to 30 veterinarians, veterinary students, and other professionals, primarily so far biologists and ecologists, are selected on a competitive basis to participate for 7 weeks. This is very intense training, 8 to 14 hours a day. The students are living and working together 6 to 7 days a week. 2 of the weeks are spent at the White Oak Conservation Center, 2 weeks at the Harbor Branch Oceanographic Institute, and then 3 weeks in a host country, in a developing country in, so far, primarily Africa and Latin America, but especially Africa. And what I wanted to tell you the most about as an example is the experience that I had in Tanzania in 2008. I spent 3 weeks with the students on the Envirovet program, and it was an incredible experience. Most of that time we were in this area, flying into Dar es Salaam and then going across the country westward to Iringa and into Ruaha National Park, and then going back to Sokoine, which is in Morogoro, and then also to the island of Zanzibar. And the primary goals of that session in the developing country, to understand the conditions and constraints in developing countries. Although there were students from many different countries, I think going to another country and seeing how they view health problems and conservation problems was important for everyone. And also to help these students develop a professional network of colleagues and be in an environment where they could freely exchange ideas, not only about the issues we're talking about, but also about the future of their careers, because this program has dramatically changed the future for a lot of the young people who have attended. One of the big advantages of the Tanzania program that I participated in was that it was able to build on a research program that the University of California, Davis has with the Vermont University, Sokoine, and funded by the Global Livestock CRISP and the Wildlife Conservation Society, which is called the HALI Project, Health for Animals and Livelihood Improvement Project, which focuses on a big environmental problem, and that is the drying up of the Great Ruaha River due to diversion from a number of irrigation programs that were set up by development organizations. Now the Great Ruaha River, that's a source of water for both humans and animals, domestic and wildlife, doesn't flow like it used to. It used to be year-round flow, and now increasingly a good part of the year, there is little or no water flowing in the Great Ruaha River. And as you might imagine, when you have an environmental change, a land use change like this, combined with what's continuing increased human population growth, that increases the contact between animals and humans. And just one of the many consequences of this is an enhanced flow, potentially or really, of pathogens, disease-causing agents, which can affect not only the humans, but also livestock and wildlife. And that has dramatic impacts on livelihood and also on the economy in this area. So I love this picture because I think it exemplifies it all. When you have so little water, everyone has to use the same water sources, and that's this woman bathing and collecting water, the livestock that you can see here by day and by night, of course all the wildlife that come down and use the same water, and of course in this same area you can see all the defecation which will, with any rains, flow into that water source. So when this project was conceived, there was a big stakeholder meeting, and it's not surprising that the high priority issues were determined to be those that were affected by this water use problem, and those that were affecting both human health and livestock health and productivity. And amongst those diseases, some of the specific agents were waterborne bacteria and parasites, especially protozoa, and also tuberculosis. So we've been involved research-wise in helping to develop programs with Sokoine University to test that water quality, look for fecal contamination, look for specific pathogens, and develop laboratory capacity so that now all that testing can be done at Sokoine University. So the benefit of this is there's an ongoing research program there in close collaboration with the host country that the students could take advantage of, not just being talked at, but actually actively participate in learning how to take water samples, test for water quality, as you can see here. They're measuring with meters here, and then go back to the laboratory and learn how to do some of these tests and be exposed to that, which was a whole new experience. And another example of this was on the Mycobacterium bovis, which is the mycobacterium that is carried by bovids, both cattle and buffalo, and it had been found, but from studies done with this project in Ruaha National Park, that Mycobacterium bovis was for the first time identified in both buffalo and in kudu. And at that time, a lot less was known about the human problem, but that's now going to be studied with a combined project with UCSF and UC Davis, looking at the human tuberculosis, but primarily focusing not only on the problem of drinking unpasteurized milk, but also environmental contamination with Mycobacterium bovis, which you can imagine in populations like this with a high HIV prevalence can be even more problematic than when it happens here in the United States. And so, as part of the EnviroVet program, the students were able to participate actively in learning how to wrestle down cattle, as you can see here, and actually do TB testing on the cattle, and then also back in the laboratory learn about how that testing is done in terms of, I don't know if you can back up here, in terms of acid-fast stains. These are they're kind of slow here. There we go. I think we missed it. Whoop. Acid fast stain testing, also culture, and then I just wanted to emphasize one of the things at Sokowini that's really working amazingly well are the rats that have been trained to detect Mycobacterium bovis in bronchial swabs from humans. So all different kinds of testing the students wouldn't have been exposed to had they just been in the United States. And another big advantage of the program is the opportunity to work closely with the pastoralist communities. That's very tricky. Any of you who know, you can't just bring 30 students in and start talking to the local community, but because the research program had established a very good rapport with the local communities, they welcomed us in. We sat with them, we talked about their culture, their different attitudes towards health, their technology, both theirs and ours. And I think it was I lived in Kenya for 4 years, and I, in that time, never had an experience like this to learn so much. So that's, I think, one of the big advantages, and overall, the students learn a lot about different health problems, not only of animals, but also of humans, in very different settings, from the pastoralist communities to the small farmers to out in Zanzibar, where here these ladies are growing seaweed as an economic measure to help support their community. And they learn a lot about management and sustainability. Have a lot of fun and build some very strong relationships. As I said, a lot of fun, a lot of hard work. It's pretty exhausting, as you might imagine, and they wouldn't be happy about that picture, but of course it's always a whole lot more fun when somebody else is doing the sleeping. So overall, it's a pretty, I think, incredible program, and I just wanted to tell you about it, to sow a seed and see if there was possibly any interest on the part of people in working with other health professionals in medicine, public health, nursing, or even in some of these other fields, environmental scientists, engineers, business, to try to extend a program like this into those areas, so we can really start taking One Health seriously and approaching both animal, human, and ecosystem health problems to the benefit of global health. Thank you.